Hello everyone, a brief talk about metabolic bone disease in premature infant. As you guys can see that these five components really interact with each other. So PTH basically control these three, and then vitamin D indirectly does all these parts. So let's start with the case. So we see in this case, this patient has, if you guys can see, these parameters like alkaline phosphatase is high, calcium is on the higher side, and phosphate is almost normal. So basically what is happening here, and we did the vitamin D level and vitamin D was low. So basically what was happening that low vitamin D was causing low calcium, and this low calcium is stimulating PTH, and PTH ultimately cause bone reabsorption resulting in high calcium and at the cost causing high alkaline phosphatase. So once we started treatment with vitamin D, you see the vitamin D level was normalized, and now you guys can see that indices are better now. The alkaline phosphate is better, calcium is better, and phosphate is slightly low because of the other functions. We never started this baby on any calcium or potash or phosphorus supplement. So this differs. You just have to remember that if the baby is receiving phosphate, then it's a different equation. So for example, let's go with this. So this is the case, like we said, look at the level here, because the phos was low and baby was not on phos supplement. So it's an easy fix. We started, vitamin D, the vitamin D ultimately did the magic here, and you guys can follow the red arrows and see what happens. So basically, in summary, when vitamin D is low, it stimulates the PTH. Increased PTH secretion of course causes bone resorption, which results in high calcium and high alkaline phosphatase. But at the cost is low phosphate, because you all remember PTH causes renal excretion of phosphate. So just remember that. But this is a simple fix. What happens otherwise? So this is a very important slide, and this is the reference. It's a very recent article. So if you see metabolic bone disease with either on the calcium deficiency side or a phosphate deficiency side, the plan will be different. So just make sure that we have all the numbers with us. We should have calcium level, phosphate level, vitamin D, and if needed, PTH. So that's a very important slide. This is another algorithm from the same article, and American Academy of Pediatric also has the same kind of guideline. So basically, all babies less than 1500 gram and less than 28 weeks should have calcium phosphate and alkaline phosphate followed up. Basing on these parameters, you decide what plan you will do. Like we have seen in this case that our alkaline phosphatase was going up. So we measured the vitamin D, we supplemented, and baby improved. And so we did not do the TRP or PTH on this case, but here you guys can see that is recommended here. We bypass that. But suppose if we have a scenario where alkaline phosphatase is high and phosphate is so low that you have to start phosphate supplement, it's always good to do PTH, because PTH is very important indicator, because sometimes what happen, increased supplementation of phosphate can again lead to PTH problems. So that's very important. So looking at all the parameters are important, and especially if the patient is receiving phosphate supplement. So that's a brief talk about it. If you guys have question, please reach out to us, and you guys have a wonderful day. Bye.